Good afternoon, and welcome to today's program, Beyond Chatbots, Building AI that Actually Resolves Patient Billing Issues, part of the HealthLeaders Revenue Cycle Technology Week. My name is Luke Gale. I'm the Revenue Cycle Editor for HealthLeaders and your moderator for today's webinar. Today's program is sponsored by Cedar. Thank you to our sponsor and to you and our audience for giving us your time and attention. Please note that an on-demand version of this program will be available approximately 1 day after the completion of the event and can be accessed using the same login link that you used for the live program. Before we get started, I have a few housekeeping details. First, to ensure that you can see all the content for the event, please maximize your event window and be sure to adjust your volume settings and/or PC speakers for optimal sound quality. Second, you will find a resource list for today's webinar in the upper right side of your screen. Here, we have listed the webinar slide deck and other materials from our supporter for you to interact with. Third, at the bottom of your console are multiple widgets you can use. To submit a question, click on the Q&A widget. It may be open already and appear on the left side of your screen. You may submit questions at any time during the presentation. However, please note that your questions will not be answered until the Q&A portion of the program. Should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. Finally, it is my pleasure to introduce our speakers for today's program. Dugan Winke, Chief Strategy Officer at Cedar, and Sumaya Rahman, Director of Applied AI ML at Cedar. Thank you both for taking the time to speak with us today. And with that, the audience is yours.
All right, thank you much. Excited to be here. Thank you all for joining us. We're gonna try to make this fairly interactive, so we have a few questions where we're excited to get your input. But maybe to introduce the session today, we are going to be talking about insights that we have seen in the wild by deploying our agentic AI, specifically within the patient financial experience in the billing call center. So to briefly introduce the session, I'll just provide a little bit of context on why we think this is so important. So as patient financial responsibility increases, revenue cycle leaders are increasingly overwhelmed by rising call volumes, complex inquiries, and high staff turnover. So the net result of this is that traditional staffing models are getting increasingly unsustainable. So many have obviously looked to generative AI as a potential solution, but our assertion that we'll back up with some of our insights is that most large language models fail to handle the nuance and emotionally charged nature of healthcare billing conversations. So we'll go a bit deeper in terms of why narrow targeted scope and domain-specific AI is really best suited to help address today's most pressing revenue cycle challenges. And these are not, the general purpose chatbots or off-the-shelf automation tools. We're also going to be chatting with Sumaya, who is going to share some of our insights around what we have learned from the over 20,000 real-world calls that our AI agents have fielded. So how do these solutions ultimately manage patient billing inquiries from start to finish, from authentication to resolution? And we'll talk you all through each one of those. So maybe to kind of wrap up the intro, we're excited to continue the conversation. So if you're evaluating AI vendors or building an internal roadmap, hopefully this will provide some actionable insights, and let's maybe dive in with brief introductions here. All right, so I will start. Dugan Winke, I'm the Chief Strategy Officer at Cedar, so responsible for net new product and go-to-market innovation. And prior to Cedar, I spent some time at McKinsey as an associate partner in their healthcare practice and also Epic. Sumaya, do you mind introducing yourself?
Yes, happy to. So my name is Sumaya Rahman. I'm a director of applied AI and ML at Cedar. I've worked for the past several years in the tech industry, building AI and ML features for companies like Apple and Intuit. At Cedar, as Dugan mentioned, we're really focused on building features that improve the healthcare financial experience for both patients and providers. And I'm excited to share with you today a little bit of what we learned along the way.
Excellent. All right, just very briefly, who is Cedar? Just want to take a minute to tell you a little bit about what we do. So at Cedar, our mission is to empower us all to easily and affordably pursue the care that we need. So we like to say that we've been using AI since the inception of our company about 8 years ago. In the earlier days, it was predominantly focused around machine learning and personalization, because our goal is to really create a billing experience that matches other consumer industries, to make it easier for patients to pay their bill, to help them digitally navigate, and ultimately, walk them through an increasingly complicated ecosystem where the patient has a number of options that puts the onus on them to navigate. And our goal is to help kind of hold their hand through that process. So why don't we jump into the material? So to start with a bit more of a Q&A session, I'm curious for those of you who are joining the webinar, what is your AI strategy? And in particular, in a bit more of a targeted manner, in the next 12 months, let's say, what role do you see AI playing in improving your financial performance and operational efficiencies? So in your bottom right-hand side, there should be a Q&A box. So would love to just get some free text responses to see what's top of mind for those of you who are joining us. Maybe we'll give it another minute or so. Another way to ask this would be, if you're looking at agentic AI, like what are those top, cost centers or areas that you think agentic AI, has the most right to win and be successful? Coding, yep. Yeah, we're going to be focused a little bit more on the patient-facing side of the equation, but absolutely, I think what we hear in the marketplace is coding and denials management are also certainly areas within the revenue cycle that AI could play a pretty disruptive role. Looks like Scott, reducing denied payer claims. Absolutely. We actually mentioned this later on in the presentation as well, but we are seeing a bit of an arms race right now in terms of leveraging AI on the denials front, where, I think I would argue that the payers maybe got a bit of a jump start, but now, providers are increasingly looking at how they can help, overturn some of those administrative denials that seem to be, increasing in terms of frequency. All right, and then Moin, hopefully I'm pronouncing that correctly. Yes, that is certainly one that we will be talking about today, which is, the customer-facing side of the equation. So billing-related questions or insurance claims and patient collections in general. All right, thank you, Kathy. All right, well, great. Well, appreciate you all offering your perspective. So we'll be diving into a lot of this. Let's start by setting the stage on why this matters. We're seeing rapid shifts in terms of government policy, with the recently passed Medicaid legislation being a kind of clear proof point here. These are going to cause risk, uncertainty, and an increased amount of patient responsibility cost share. So we are seeing these pressures on the patient side. On the provider side, we're also seeing staffing shortages, inflationary pressures, supply chains, tariffs, they're driving up labor and supply costs. Combined with, what we just talked about, where payers are also looking for opportunities, to leverage AI, and oftentimes, that results in increased, denials or declined reimbursements. So with operating margins already very low, providers are under increased pressure to capture every dollar that they can. And I know you all are being asked to do more with less. So patient collections, I think, has certainly increased in terms of the relative priority within revenue cycle. And this is a pretty large shift. Like the one way I like to think about it is that patients are now your fastest growing and most difficult to collect from source of revenue. So this is quite the paradigm shift from maybe 10, 15 years ago, where it was predominantly, payer relationships and payer reimbursements that moved the needle the most. And, that I think that is still a factual statement, but we are seeing that patient responsibility portion be increasingly more and more important and relevant. So that was a bit of, some of the pressures predominantly focused on the provider or hospital side. But, if providers are facing economic pressure, I like to think that patients are feeling the heat, and they're feeling the heat because they are increasingly responsible for a larger portion of their healthcare responsibility. And really the revenue cycle infrastructure was architected for a B2B, business to business world. So, the majority of the investment, time, and effort was focused on collecting from a handful of large, predictable payers. And I would argue that no longer exists. So with the rise of high deductible health plans, increased coverage gaps, and more financial responsibility falling directly on the patients, your patients are, one of your largest payers. And the critical difference, in our opinion, is that they're a payer that has no training, no staff, in many cases, very low healthcare literacy. So they really do need engagement, and they need engagement based on what their problems are. And many times, like, they're going to be calling in with more questions than answers. So that's what Sumaya will be getting into here shortly, and walking us through a few of those insights and how AI needs to correspondingly flex. All right. So if you remember last year, we had a similar. We kind of were introducing this in a more conceptual manner, and we had this provocative question up here, which is, imagine what it would be like if 30% of your calls, went away. And I think we're kind of happy to report here this was more of a conceptual thought starter question last year. Like, we have real results this year and can actually back up some of our impact stats. But it is a significant opportunity for improvement. Ultimately, it's a huge friction point for patients, and a single confusing bill is not a minor inconvenience. It's the starting point for a very expensive and inefficient internal process. It's the first domino to fall. So if you were to think about this from more of a rev cycle leader perspective, every phone call that patient calls in with, that has a cost. Every additional paper statement you have to mail has a cost. Every collection letter you have to send has a cost. So there are many opportunities where we firmly believe that directly connecting the dots between how you can interact and solve a patient proactively earlier in the Dunning cycle will yield benefits down the road and ultimately help you reduce that overall cost to collect. So we do not think that this is a one-size-fits-all answer. Patients behave differently. They are consumers in the same way that your Spotify playlist is going to look different than my Spotify playlist. We need to meet patients where they are and use a combination of analytical methods and AI-powered analysis, to ultimately train our model on how they can understand the intent of call, and then how we can provide a personal resolution pathway. So with that, I'm gonna just introduce briefly, our idea of AI-powered automation through AI voice agents. So healthcare, I think we've heard that many healthcare organizations are increasingly turning to AI voice agents as one potential solution. But what I would propose is that building the right strategy needs to start with the problem. Many of these vendors out there are a solution in seek of a problem. We at Cedar tried to kind of take the opposite track, which is we already have been working with providers on patient financial engagement, and we knew that this billing call center was a large source of friction. So that is where we started, and it's not just which calls can be automated, but how the resolution actually happens. So unlike generic purpose chatbots or off-the-shelf automation tools, this idea of purpose-built AI, I think, is really important. So what is the data that you are actually using to feed that model, and how can that help answer patients' questions? Oftentimes when patients are calling in not really knowing what their problem is, and operating from a source of frustration and lack of financial literacy. So we need to educate and hold their hand through the process. All right, so maybe to briefly close out my section, and then I'm gonna hand it to Sumaya, the real star of the show, to talk through some interesting insights here. But what we're gonna show is what we've learned. What are some of the insights from the 20,000 plus real patient billing calls that CoreR AI agent has fielded? And what are some of those findings, and how is it impacting where we are investing disproportionately? So you'll see where the automation can drive impact, what's making these conversations deceptively complex, and ultimately the core capabilities that AI must have in order to reduce costs and improve patient experience. So I listed a few of our kind of key takeaways, but I'll just read them out here because they are pretty important. Authentication consumes more time than you think. Like, there are many activities that call center representatives do on every call that really significantly add to that handle time and are unnecessarily complex and low value add for an actual live customer service representative. So we'll be going into that example. The second piece I alluded to a little bit earlier, which is a lot of patients are calling in not because they have a clear intent to pay, but also simultaneously not because they're opposed to paying. They're calling in because they're confused, and they need to have their question answered before they're willing to pay for that responsibility. And many times those patients often are presenting symptoms, not diagnoses. And what we mean by that is they may have a concern around affordability, or they may have a distrust that the payer processed their claim correctly. But those are almost below the waterline in a way, where they're calling in without knowing exactly what their problem is. So we need that AI agent to be a bit of that diagnostic lens to ask probing questions and understand what is predominantly the concern first, and then how do we solve that concern second. So the last one would be, being factually correct is not the same as being helpful. And this is really alluding to the fact that, empathetic AI is core to our value prop. And, healthcare and financials associated with, a care journey is a very personal, emotionally charged conversation. So having the right answer in our mind is not simply enough. It's how do you form that relationship with the patient? How do you build that trust? And ultimately, how do you answer that patient's questions? So We're going to be going through each one of these one by one, but I'm now going to pass things over to Sumaya, who's going to dive a bit deeper into each one of these takeaways.
Sounds good. Thank you, Dugan. So let's start with the first point around authentication. So if we're thinking around building AI for patient billing issues, we want to hone in on the most relevant use cases that occur across many calls. And a lot of leaders might jump to thinking about how AI agents can automate things like balance inquiries and payment requests. But there is that low-hanging fruit in the beginning that happens in almost all calls, and that's authentication. So usually billing conversations start in the same way. Agents manually collect names, date of birth, and other protected health information, and they need to do this before they can discuss anything meaningful. It's a requirement and it's a costly one. Every single call that involves PHI needs this. HIPAA mandates identity verification, and providers often have their own policies around it. This burns valuable time. In these cases, agents can't access account details and begin resolving the issue until the identity verification part is done. And probably the most interesting part is that it's trickier than it sounds. It might seem pretty straightforward, but if you think about it, patients pause, speak in fragments, or they might switch between voice and keypad inputs. And this process varies by caller type. There's patients, guarantors, spouses, caregivers, and even insurers who might be calling on behalf of for the patient. And authentication will look a little bit different depending on who's calling and how they're speaking. So we've talked about how authentication blocks every call that involves PHI from progressing forward, and different caller types require distinct verification approaches. And I think with this comes a really interesting AI design implication, because AI must handle fragmented information collection across multiple conversation turns and adapt the authentication workflows for different caller types. So the thing that you want to look for here is flexible verification that can resume if interrupted and handle unclear responses, rather than rigid scripts that would fall apart when conversations don't follow expected patterns, because most of the time they don't. So now going into some early results from Cora, our AI voice agent, we can see the potential of this. So when authentication was successfully automated, the average handle time dropped by around 13%. Shifting the agent's capacity from routine verification to more complex problem solving that actually requires their expertise. So one thing that you might have heard before is that there are certain types of patients who are always going to call, no matter how easy the online bill pay experience is. And that might be true, but they're rarely calling in just to make a payment. In fact, at one large healthcare system, we found that only 4.2% of calls were actual payment requests, and most were confusion-driven inquiries, as Dugan alluded to earlier. So these are things like, why do I have a bill? Has insurance paid yet? Do I qualify for financial assistance? And one insight that we took from this is that all of these are often navigation challenges. So agents act as human routers. They're connecting the dots across third-party payers, Medicaid enrollment vendors, collection agencies, and more. And as these calls grow in volume, the old way, which is just adding more people or more phone tree options, can't scale efficiently. So we know that confusion-driven calls really do require connecting the dots across systems and vendors to give patients clear answers about coverage and assistance programs. And when we think about AI, what AI needs is access to things like insurance benefits, eligibility rules, assistance policies, rather than just straightforward account details for that patient. And it needs access to these different sources in order to resolve navigation problems effectively. So the thing that you want to look for here is systems that have diverse underlying data sets that eliminate that let me transfer you moment when patients actually need clarity beyond what's immediately visible in their account. So if we think about other industries where AI might be applied, like retail, customer service requests there would have very straightforward intents. For example, track an order, cancel a subscription, request a refund. The customer might name the problem, and then the agent resolves it. But as I think all of you might know, calling the hospital billing office couldn't be more different than that. So what we've seen is that patients frequently don't know how to describe what's wrong. They just know that something feels wrong. And that means agents have to take the lead. They have to comb through account details, decipher insurance explanations, and connect disparate charges, all while keeping the conversation on track. So in an analysis we did for calls at one health system, we found that billing questions can actually be one of 71 different inquiry types that stem from 61 different root cause groups and might require one or more interventions that span 99 different resolution categories. So this complexity creates costly operational challenges. There's long onboarding times. New agents must master hundreds of potential scenarios that are created by these intersecting complexities, which delays speed to productivity. There are also knowledge gaps. So even tenured agents often encounter new edge cases, leading to prolonged resolutions and variations in how patient questions are handled from agent to agent. And one thing you all may have seen is high turnover rates. So the steep learning curve and high cognitive load leads to burnout, attrition, and constant reinvestment in training. So since most calls don't start with this clear intent, instead it's more vague inquiries that actually require the agent to do more skilled investigation to uncover the real issue before resolution begins, this has some really important implications when it comes to building AI that can do this. So AI must guide patients through discovery with smart follow-up questions while simultaneously analyzing account details to identify the potential root causes. So the thing to look for here is conversational flows that clarify intent by combining patient responses with the underlying account context. Rather than just doing reactive questioning or data retrieval alone, the combination is what ends up being really effective. So when agents pull up a patient's account, they're looking at dozens of data points that span multiple dates of service across different billing cycles or even across different years. And the challenge isn't just finding the right information, it's knowing what to ignore whilst the patient is still figuring out what's wrong. So, for example, when we analyzed around 13,000 billing calls at a large physician group, we saw that 11% of those involved accounts with bills and collections. But if we look at the resolution flows for those, we saw that agents provided collection agency contact details in only 37% of these cases. So maybe the patient was calling about a more recent invoice or had a completely unrelated question. And that's why the collection agency information wasn't relevant to that particular call. And we know that while some calls might come with clear intent, many do not. So when a patient says, I have a question about my bill, the agent has to figure out, first of all, which bill are they talking about, what the issue is, and in this particular scenario, whether collections would even apply. And getting this filtering wrong is costly. So if you surface irrelevant information, you've turned what should have been a quick billing question into an escalation. On the other hand, if you miss relevant details, you fail to help the patient address their most pressing financial obligation. So the challenge here is that billing systems surface dense chronological data, but resolving patient questions requires relevance filtering rather than a comprehensive data dump. So here, the AI design implication is that AI must learn which data points matter for specific inquiry types, rather than just defaulting to comprehensive account summaries. So the thing to look for is information architecture that presents AI agents with relevant details first and suppresses any irrelevant details until they're actually needed for resolution. So now that I've shared some of the technical learnings and design insights, I can hand it over to Dugan to sum up what this means for patient billing support.
Yeah. So thank you, Sumaya. Hopefully that helped demonstrate a bit of our right to be a thought leader in this space. And I think personally a lot of those insights are some of them are intuitive, some of them are not, frankly. And I think that's key. That's key to this discussion is, by having this rich ecosystem of data, and also being able to have that continuous feedback loop where, we are on a, daily basis monitoring, like, where did Cora successfully resolve the call, where did Cora did not, and where it did not, why, and how do we actually go back and fix that, either in our digital ecosystem or through our AI voice agent. So maybe, maybe to start rounding things out, and then I do think that we'll have a little bit of time for a Q&A, which will be great. But, given the unique complexity of patient billing support, our assertion is that traditional approaches like outsourcing and legacy technology are reaching their limits under current cost pressures. So we do firmly believe that AI voice agents offer a new path forward, with a big caveat, right? Like, only when it's built within embedded healthcare billing expertise and the right data sets. So that ability to carry on a conversation is not the same as resolving a complex billing issue. And, I think, if you play this forward over the next few years, those are going to be, the agentic AI, vendors that really rise to the top. It's going to be those who, like, successfully complete the task. And successfully completing the task in this case means answering the patient's question, not simply carrying on a conversation, or, having a slicker way to say you have $5,000 due, like, enter your credit card here. I think, like, the key thing that hopefully you took away from was, we need to first answer, the below the waterline questions that are preventing them mentally from being willing to pay and resolve their bill. So to think of, an AI agent that is simply facilitating a payment is, I think, missing a bit of the full scope of what, call center representatives do on a day-to-day basis. And in order to get that, right, we need to help unlock step change efficiencies. So fewer staffing needs, faster resolutions, and ultimately higher patient satisfaction. That's our North Star. All right, so we briefly alluded to Cora, but just want to spend 2 minutes just giving you a quick overview. So we recently launched our AI-powered voice agent, Cora, based on these principles. So Cora is purpose-built for patient billing inquiries, and it leverages Cedar's billing data and deep healthcare expertise to deliver accurate, empathetic, and highly personalized support. One thing I like to say is, this is not a billboard in an exhibit hall. Like, Cora is live. Cora is currently supporting patient calls at Apollo MD, which is our Innovation Alpha partner. And we're rapidly putting Cora into place at a number of other health systems as we speak. So it is part of our support offering. So there's a few different variants. It can be, the AI agent in isolation. We also have a more full scope service that combines traditional call center servicing and excellence combined with, this AI technology to truly transform the, billing support workflow end to end. So we are on track to automate 30% of billing calls by the end of this year. We shared some of those early results around some of our initial use cases. We're successfully authenticating, greater than 60% of eligible callers, and we're fully resolving about 50% of eligible calls. So eligible calls meaning, like, use cases that we have built, of which we're adding additional, AI use case and resolution pathways on a weekly basis. And then the last stat that I would add is, 13% handle time reduction for those, calls that have been authenticated. So we are excited to share this with you all. Hopefully you found, some key takeaways that, resonate with your organization. I would would love to continue the conversation. We have an automation strategy assessment. And what this is essentially we will ingest, call recordings from your health system, or, if you're unable to share call recordings, we have a few other ways that we can assess and run it through our LLM to determine, what do we think your personalized automation potential is based on, all of those 90+ resolution pathways that Sumaya was discussing earlier. So this is really important because the unique complexity of patient billing support and traditional approaches are reaching their limits, and we need to find a way to increase and unlock additional efficiency to allow those call center representatives to operate at the top of their license, but also find a way to reduce costs and get away from some of the rigidity of legacy technology and IVR solutions. So we have a QR code here. We are happy to do a free automation assessment if desired. I think I'm also available if you just want to chat a little bit more and learn a bit more around the solution. But with that, I think we are right about on time. So we are going to be able to, have some time to take some questions. So thank you all for the time today. If you have, questions, happy to answer here, whether it be, what's on the roadmap, what are some other best practices, how does the, the big beautiful bill that was recently passed kind of impact this. I can take the conversation a number of ways, but maybe would ask people to chime in on the Q&A in terms of what would be most helpful for you all.
Thank you, Dugan and Sumaya. Really excellent presentation. And that does bring us to the Q&A portion of the program. So we would like to invite you to ask live questions for our speakers. As a reminder, to submit a question, click on the Q&A widget at the bottom of your console player. It may be open already and appear on the left side of your screen. Please note that your questions will remain anonymous and will not be viewable by other audience members. And I'll start off with an easy one. Dugan and Sumaya, we'll start with you, Dugan. What are your top 1 or 2 takeaways from this discussion for our audience?
Yeah, there's a lot behind this. I think in my mind, the key takeaway for healthcare providers is that this recent legislation is going to increase the need for healthcare providers to stay connected with their patients outside of a specific care delivery episode. And what do I mean by that? It's Medicaid patients are now going to have to demonstrate work requirements on an ongoing basis. The retroactive window where patients, could seek care and then post-care qualify for, Medicaid is shrinking. So it's, I think it's going to require providers to spend a lot more time engaging their patients and walking them through, this even more complex affordability, web. Because if you qualify for Medicaid, great. If not, there may be an ACA plan. If not, what about medication assistance or extended, like very, very long-term, like repayment options, such as payment plans? All of these are not going to be a one-size-fits-all answer for patients. And it's going to require a bit of that personalized resolution pathway based on what that unique patient is qualified for. Excuse me. So tying it back to the original question, I do think, as we look at additional agentic AI use cases, like the financial counselor workflow is certainly one of those, where if we can reduce, some of, those lower complexity tasks and engage with patients to proactively surface affordability options, that could be, needle moving, especially as we look at increased self-pay projections and increased cost share for patients. All right.
Thanks, Stephen.
So excellent. Looks like a good amount of questions here. All right. So maybe Sumaya, do you want to take Kathy's question around, are the AI agent interactions with the patients dated and logged in the EMR EHR?
Yes. So when the AI voice agent Cora completes an interaction with the patient, we do save and log that information. And we save a couple different versions of this. One is the original transcript, which has every back and forth between the AI and the patient. And we also create summarized version or notes of what happened during the call. And this is useful in a couple ways. This is useful for the human agent who might handle the latter part of the call in a live handoff scenario where maybe Cora is able to answer the first part of the question, but then maybe needs a continuation. So we create a summary for that handoff. And then also the stored summary of the call is really important just for storage and kind of compliance needs to save that for future reference. We have a product at Cedar called the Operator Portal, where the operators are able to interact with patient histories, and this includes like the previous calls that might have occurred. And we do have the ability to download things from that operator portal and import them into other places, for example, the EHR.
Yeah, also worth noting that operator portal integrates within Epic. It's a tab within the EHR. So most of our healthcare providers, that's their desired workflow is they're interacting through the operator portal. We're obviously sharing data back to the EHR, but that's where they're going to find a lot of their billing related material and reporting. Excuse me. Kathy also asked, when did we launch Cora? Yeah, so we've been working on Cora for several years now. We officially launched Cora at Health last year, back in October, and then we went live with our first customer this April, I believe it was, like end of April.
Yep.
And we're expected to have 10 plus clients live by the end of the year. But it is a nascent industry. Agentic AI is new. We're very proud that we would say we're ahead of the curve, both in terms of building this solution, maybe before a bit of the hype bubble, combined with, as a result of that, like we're actually live and able to demonstrate real results. All right.
Can I ask, so you did mention the One Big Beautiful Bill, and in the wake of that bill, and kind of as we see the regulatory landscape shifting more broadly, where do you see the most practical use cases for AI as it pertains to affordability?
Yeah, that's going to be pretty similar to some of those like resolution pathways around that financial counselor AI agent that I was referencing earlier. So right now I think like the fundamental problem in my opinion is that the ownership to call in and determine what affordability mechanisms are available to a patient kind of falls on their shoulder. Providers try their best to proactively reach out, but they just simply don't have the capacity to, provide that level of, proactive intervention. And as a result of that, what we find is, the patients that tend to, use the system as it was designed to be and call in and advocate for themselves and ask for, various affordability mechanisms. Those are oftentimes not the patients who need it the most, because those patients we know, from our data have low digital engagement to begin with, and they tend to have pretty low financial literacy. So how do we kind of help fill that void? So we are reaching out to patients proactively. We are surfacing programs and aid that they may be qualified for. And we know that because of, our data and our integrations with providers. And then how do we be, a resource, leveraging, agentic AI to walk them, answer their questions and walk them through the application process. So that's, I think, kind of where we're going. That's, scoped on the roadmap, but our initial use cases have been focused more so on the billing call center side.
Thanks, Dugan. This might be a good one for Sumaya. What are best practices for keeping AI tools up to date as healthcare rules and billing systems continue to change? One thing that I hear from revenue cycle leaders a lot are challenges around, price transparency regulations, and also just shifting payer policies. How do you kind of confront that, Sumaya?
Yeah, so the way I would suggest confronting it is by allowing a lot of flexibility and room for updates in terms of the information that's fed to the AI. So when it comes to building AI, there are a couple different ways you can train an AI or impart certain information on it. Some of these are more in the original pre-training stage or in a fine-tuning stage where we are updating the embeddings in a large language model to really hold a particular set of information. But what I would actually suggest is rather than updating the embeddings themselves, there's the option to feed in information as part of a prompt to an AI and have a very structured the places where these policies are stored. And as policies get updated, the information that gets surfaced to the AI can be the most up-to-date. Any recent changes that have been made to a particular policy can be surfaced to the AI at the time that it's making the billing resolution decision in terms of how to answer a particular question, how to help a patient with something they need. If the information that's being fed is kind of the latest and greatest and not something that is kind of stuck and rigid in the underlying embeddings themselves and is rather something more flexible, that really gives the ability to not be stuck to any particular old information, but update information as it comes.
Thanks, Maya. Next question is, does Cora perform sentiment analysis and adapt its dialogue in real time to customers' moods?
That's a great question. So definitely, yes. What we've seen is that when customers call in, you're going to have a variety of people calling in. Some people might be, more calm, have something very straightforward. Some people might call in a little bit more frustrated, maybe even angry. And what's really important is meeting the patient where they are and adapting the conversational style to the patient's particular sentiment, mood, or the type of question that they have. So, for example, a patient that's really frustrated might actually need more empathy and more guidance as they are guided through their particular issue. And that's something that we found ends up being very effective is when we really tailored the communication style to the particular patient's needs.
Thanks, Maya. We have another question here. Can the AI agent remember a previous conversation? If a patient calls again, does it have to restart from the beginning for whatever the original inquiry was?
Yes, the AI can remember previous conversations. And the way that's done is in the prompt, as I was discussing earlier, we can include different parts of information. So some information might be, the hospitals or insurance policies and procedures. Some information might be the patient account details. And then another part of the information can be the conversational history. So that can come from previous calls, previous engagements that the patient has had, whether it be digital engagements or times that they've called in and had a conversation. And if we can include that history as part of the prompt, the AI then has that context and can know what was already said to the patient. They can, learn from that previous interaction, like is saying a particular thing, something that did or did not help the patient, and sort of pick up from where they left off at the time of the last call.
Yeah.
Thanks,
the other thing I might just add to that is there's also remembering from AI agent interaction to customer service representative handoff. So let's say, Cora is able to authenticate the patient. They're able to identify the bill that they're calling in about. They're able to maybe answer some, but not all of the questions. and ultimately like it gets escalated to a human call center agent. Like having that AI co-pilot that is then able to then replay all of that information so that you don't spend time asking the patient the same information, because I'm sure everybody has gone through that in some form or fashion. Like there is nothing more frustrating than following the digital flow and then presenting in person and having all that information re-asked of you. So that digital to human handoff is incredibly important.
Yep. Alongside building Cora, we are building a co-pilot for agents. So this is exactly what Dugan was describing. Like if Cora completes a part of the call, sometimes it ends up not, it would end up not being useful if the human agent who then completes the next part of the call doesn't have that information that Cora already collected, or that history of what Cora already was able to resolve for the patient. One clear example of that from a recent use case that we launched is in the collection of insurance information. So let's say a patient wants to add or update their insurance. We would have Cora collect certain pieces of the insurance details. And in the co-pilot side, we then have this view for the agent so they can see exactly what are the information pieces that were successfully collected, and if any were not collected, what there is left as remaining. So having that really tight integrated sync of information between Cora and the human is what really drives these efficiency gains.
Thank you both. Great stuff. Dugan, this might be a good one for you. You mentioned in the assessments that you can do for health systems, looking into their operational constraints and complexity drivers. What are some of the biggest complexity drivers and operational constraints that you're seeing out there?
Yeah, it's we can kind of go. We actually have a bit of a waterfall chart that like breaks us down. Like it's not a simple answer, and that goes back to those like 90 plus resolution pathways based on the problem statement. But the big ones, one, are things that frankly just take time, and a human in the loop is not needed. So one example of that would be patients calling in because they need an itemized statement because their payer requested it. That is something that is extremely simple, and I need a piece of data. So those are, I don't know the exact percentages, but I think we kind of estimated, like one client, it was about 10 to 15% of their calls were just extremely simple. Like I have an information or a kind of simple request that I need to have either answered or sent to me. The largest bucket in general is going to be questions that sit at that intersection of provider and payer. So this could be, I don't understand why I'm getting this bill. I have insurance, and that response could be yes, but you have a high deductible health plan and you've only met half of your deductible. Another common component of that is questions about whether or not their claim was processed, what insurance covered. Was their claim denied? If their claim was denied, why was it denied? So all of that, I think, we think is part of, what makes us special, is that we are integrated with over 200 plus, payers. So we're able to kind of sit at that intersection between provider and payer and answer some of those questions that even frankly, a health system customer service representative wouldn't necessarily have at their fingertips, because it is information about their like payer and their claim and their EOB, not necessarily like the bill that went out from the provider. So the other big bucket, I would say, it does tend to be like affordability that I alluded to. So they want to pay, but they cannot just pay their bill in full. So what are those alternative options that they're matched with?
Thanks, Dugan. We are just about at time. Any final thoughts from your review?
Just want to add
No.
that I think it's really exciting to be working in AI, especially as applied to healthcare. I think one of the questions sort of alluded to how fast things can change, both on the healthcare side, as we've seen with the One Big Beautiful Bill, like there's always these new regulations, policies, things that are getting changed, but also on the technology side. AI is moving at breakneck speed. The tools, technologies, best practices are changing week to week, even day to day. And I think, yeah, it's a really exciting space to be in. We've had a really great time learning about it, sharing some of these insights back with you. And yeah, we would love to continue the conversation.
Yeah, likewise. Flashing the QR code up here one last time, but yes, enjoyed the time, and hopefully it was a good use of an hour. So thank you all.
Thank you, Dugan and Sumaya. That's all the time we have for questions today. I want to thank our speakers once again for an excellent discussion, and our sponsor, Cedar, for making this program possible. Finally, thank you to you and our audience for participating. We hope you'll join us in the future for another Health Leaders webinar. That concludes today's presentation. Thank you.